Namaskara. I'm Dr. Sunita Rana Agarwal from Dr. Agarwal Hospitals, Bangalore, and I'm an ophthalmologist as well as I do genetic medicine. Eye pain and headache are usually coming together because today's number one cause for eye pain and headache is dryness of the eye. Whenever we start treating the dryness, we notice that the headache also reduces. However, there are certain situations where just that is not going to be enough. When there are more serious conditions like glaucoma, like migraine, these require more specific treatment. Glaucoma means the pressure inside the eye has gone up. This produces a very typical, very problematic eye pain and always associated with headache. In this, we like to first check, does he have glaucoma? That means is his pressure in the eye more than 20 millimeters of mercury? Is his vision restricted? So his peripheral vision starts getting reduced. And third, migraine, where we are going to do lots more testing to find out if it's migraine. Today, some of the most important treatment options. First is to treat the dry eyes. Second is to treat the glaucoma. And then go into certain other conditions like you can use monoclonal antibodies to treat migraines and so many other issues. But for treating only dry eyes, we still would recommend that you use eye ointment, artificial tears and silicone plug. What we mean by a silicone plug is there are two canals in our eye that takes the water of the eye into the nose. If we block one canal with a silicone plug, then we are able to retain moisture in that eye for a little while longer. Even if we give you all kinds of pharmaceutical products, over-the-counter, artificial tears, anything, it's not going to replace the mucus that the eye secretes. That mucus is very important for water to enter into the epithelial cell of the eye. In this way, if we put a silicone plug, we are able to bring back the mucus and the moisture to the eye. Where glaucoma is concerned, it's a degenerative disease. That means if we look at 90-year-olds, 90% of them will have glaucoma. That means it's a progressive disease, it's a degenerative disease. How do we treat it? So what we need to do is take one drop of blood as injections to the eye. This is in the skin of the eye, not inside the eye, and then into other parts of the body. It repairs his problematic DNA now that has produced the glaucoma. Whatever the disease, whatever the condition, there will always be a DNA that is malfunctioning. That's called a mutation. Whenever there is a mutation, it will always bring a wrong protein into the body. The signs of eye strain is that if you would like to treat it, it will go away. Very simply, if you take a cold compress, do palming. These are some of the exercises, yogic exercises. So one of the most important thing is to do palming. We close both your eyes with your hands, make sure there's no light entering and count 20 breathings. 1, 2, like that, 20 breathings. Then you shift your focus to a 20 feet distant object, then to a near object. 20 feet distant and near, and or blink. So you use a ball, throw it on the ground, blink. Catch in your hand, blink. These kind of exercises will definitely reduce your eye strain. Now, if it has not treated your headache, there is a migraine. Second most important difference over here will be the migraine will be half-sided. Whatever be the condition, whether it is an eye strain or it is a migraine, we will be able to treat it in any condition with monoclonal antibodies, definitely. Sinusitis is a very, very important cause, and earlier we used to 100% make sure that everybody comes up with their X-ray of their sinuses. But today I am not finding that much of a need for that, because by the time we start treating the patient with the eye strain and headache, the sinusitis also starts to go away. However, if there is sinusitis, most important it will be mostly in the morning, whereas all the eye strain and the cluster headaches and the tension headaches will most likely be in the evening. Second, there will be a running nose. There will be something about the nose that there will be water coming or you're sneezing or one of the others. Once you've treated the sinusitis, we may be able to go back to telling you all that also stemmed from dry eyes. That means your sinusitis was also coming from dry eyes. If we put a silicone plug into the eye, we have treated the sinusitis. So today I don't need an X-ray of the sinuses because I know that I'll be able to treat the patient by putting in a silicone plug. Glaucoma headache is usually unilateral. It's one eye, its pain is too much. Second, there will always be halos around the light. When you look at light, it's not just light. There will be all the Vibgyor colors coming around that. More important, glaucoma is a silent killer. That means he's a thief in the night. He takes away and he doesn't give back. Here, once again, we'd like to stress that we may be able to bring it back as well. If you can do a confrontation test of yourself, that means you keep your hands at 180 degrees and then keep seeing at what distance do you see them. So I'm able to see them at this distance, then it's normal. At this distance, at 90 degrees, it's normal. When this becomes lesser than that, then you know that there is a problem and you need to go in and get your eyes checked up for glaucoma. Mostly we like to first see an eye doctor, and when simple things like eye strain and refractive error, cluster headaches, tension headaches are not treatable and we have unilateral vision loss for any reason, it is far better, especially if the eye doctor has already taken the field test. When we take the field test, we will know if this is a neurological deficit. That case, an MRI is imperative. Most eye doctors will already tell you to go get an MRI of the brain in a screening method. And this helps us to now send the patient to neurologist. If the neurologist has already examined and still finds that he is not able to treat the eye strain, he will himself send it back to the ophthalmologist.